We talk a lot about COVID-19 protocols in schools as parents once again try to determine how to keep their kids safe from the threat of coronavirus and the Delta variant. But for parents of kids with allergies and asthma, preventing them from having flare-ups or extreme allergic reactions will also top their list of priorities. So in today's To Your Well-Being segment, WFMY News 2's Tracy McCain breaks down the plan that doctors recommend you put in place to limit serious reactions at school.
Tamir and Taj Palmer are brothers, just 1 year apart. They'll go to school together this month with a list of foods they can't eat, which makes their mom nervous.
It is. It's very scary, and it's very scary when they're not with me.
Tamir and Taj are allergic to nearly a dozen different foods.
Tamir is allergic to peanuts, tree nuts, eggs, fish, squash, oranges, apples, pineapples, green beans, onions, and I think I got all of his list. And then Taj is allergic to eggs, peanuts, tree nuts, and milk.
Their list of no's automatically removes yogurt, milk, apples, as well as childhood favorites PB&J and pizza from their school lunch options. Allergy and immunology physician Dr. Joel Gallagher says even having those foods at the lunch table puts them at risk.
Hives over your whole body, throat itching, throat swelling, coughing, wheezing, vomiting, even just abdominal pain.
Extreme cases require epinephrine or an EpiPen.
Here's the more traditional EpiPen.
Dr. Gallagher says if your child has a food allergy, make sure an EpiPen is part of your allergy action plan.
Anyone can look at the allergy anaphylaxis plan and go through the steps if the student is having an allergic reaction.
Updated numbers released this year from the CDC shows 1 in 13 children, or about 2 students in every classroom, has a food allergy. Most of them are allergic to one of these 8 foods: milk, eggs, fish, shellfish, tree nuts, peanuts, wheat, and soybean. Just added as the 9th major food allergen, sesame.
If you have a school lunch and you have milk on it, and you're allergic to milk, what are our options here?
Thankfully, we live in a world that there are a lot of good milk alternatives. There's an oat milk, which is really healthy.
The plan for Tamir and Taj is centered around a lot of communication between their mom and the school, plus having that plan in place.
With school, I do try to just trust that they'll read over his list and make sure that they're not feeding him snacks that he can't eat.
Whatever it takes, she says, to keep her son safe at school and out of the ER. In Reedsville, Tracy McCain, WFMY News 2.
EpiPens are only available by prescription and they expire every year. Your emergency allergy plan should include an EpiPen that's expiration date is several months out. And remember to give it to your child's school on the first day or at open house. All right, so when it comes to keeping kids healthy, especially with school starting back, the checklist, it can be pretty long. So Dr. Kate Edifa with the Tim and Carolyn Rice Center for Child and Adolescent Health, she's joining us now to review a few of those items to help keep kids healthy. All right, first and foremost, let's talk back to school immunizations. Just how important are they, and what should you do if your child maybe hasn't received their immunizations yet or may have just kind of gotten behind because of COVID?
Yeah, well, certainly not every child's favorite part of their doctor's visit. Immunizations are very important to keep our children safe and healthy. And now is a great time to catch up on any vaccinations that your child may have delayed or put off due to COVID. Childhood vaccines protect against many infections that can be harmful to babies, children, and teens. And especially with many children returning to the classroom for in-person learning, it's important that all children are up to date on their immunizations to prevent outbreaks of potentially dangerous illnesses like whooping cough or measles.
Okay. You know, a lot of us kind of put things off in the last year and a half, so maybe even the well child exam may have been put off. What happens during the well child exam? What should you expect? How important is that?
Well, well child exams are an important part of routine child health care, and they really help us to monitor the growth and development of your child. So now would be a great time to reach out to your doctor's office to schedule an immunization or well child visit. During a well child visit, your medical provider will talk with you about your child's nutrition, physical activity, sleep, and behavior, among other things. And this really gives us as medical providers a chance to give personalized advice during the well-child visit to help keep your child safe and healthy throughout the year.
And that's really what we're looking for, is that personalized advice, right? We hear lots of big picture things, but we want to know what is the best thing for my kid. That's what the bottom line is. What's the best thing for my kid? All right, more on how to keep your child healthy all year round. That's coming up next.